Hi there. My name is Melody De La Rosa, and this is going to be my discussion summary of empathy and using interpersonal skills while working with clients or families. So I did meet with my clinical supervisor today, and so what we discussed is that first of all, when before we use empathy in an empathetic approach, we first should determine the characteristics of the individual and include that within our evaluation as well as how we use empathy with the client. We look at the age, we look at the cultural competence, right? Their culture, their traditions, their values. Looking and asking the client about any experience they had, what brought them into therapy, why are they there, what are they seeking, what are previous therapy that they did have, do they have any past experience? Like an example, if a teen were to go into office, right, asking them, why are you here? And they're like, I'm just here. Oh, okay. Who motivated you to come here? Was it yourself? Was it your parent? Was it a significant other? Is it you who wants to come to therapy? Or is it someone else who's pressuring you to go to therapy? And once we find that out, then we can start working on our empathetic approach and how we approach the situation. And with empathy, it's providing, yes, you can provide understanding within the situation and provide agreeable answers, but at the same time, it's not always about agreement, it's about connection. It's about helping the client understand and feel like they are valued within the empathetic approach. So when we do provide empathy, we first have to make a very safe space for them. We have to make sure they're comfortable, that if they're thirsty or hungry, provide them a snack, drink, have them ready to go to provide, so that we can provide therapy and so that they could open up for us, because the main thing is providing a safe and comfortable environment so that they could communicate efficiently with you. Once we have that established, we want to make sure that we as the individual, I'm a trainee, right? So as a trainee, when I do work with my clients at the Delray House in which I work, you often also have to look at where your gaze is, your position, just how you look. Do you look professional? Do you look put together? Like your facial expression, do you look tired? Because when you work with the client, they're constantly viewing you, looking at you, and we don't want to be that person that they have their mind on. We want to be the person to motivate them to talk about their problems. And so once we have that all ready, then we ask the hard questions on why they came to therapy, um, and then also asking them about their feelings, asking them about what are they experiencing, what's on their mind, how are they feeling. And so once we get through that, we can start doing an empathetic approach, which means providing just providing active listening, which is also an interpersonal skill. Providing active listening so that when we meet with the individual, they feel valued, because they might not feel valued in how they in the doctor's office or at the nurse's office, but within their own setting, they are important, and it's up to us to provide the empathy so that we can relate to any past experience. And if we're not relating, providing that support and that comfort, and okay, I understand where you're coming from, thank you for sharing that with me, and having them still communicate. And if there's any input that they're seeking, providing them that input. And so besides doing that, my personal strengths, they align with interpersonal skills such as having empathy, having patience, having active listening, being motivating for them, constantly just giving them that comfortable environment for them to open up, giving them that motivation so that they can continue to have a planned change in their life. And I think with my personal experience, I've gone through a lot, being homeless, being the oldest of six siblings, having no mother, having an absent father. And so I know I have my own experiences that shape me to who I am, which is being patient and empathetic and being understanding, supportive, and also motivating the individual because I had to motivate myself. And so this is my chance to be motivating to the individual, not just to, um, to be motivating. And so I feel like my personal strengths align with it because I've built my strengths with, which is my values. And these interpersonal skills are important within the NSA and ASW field because it interlinks with our six values and with our ethical standards. So, on one example, having dignity and worth of a person. So making sure that we respect them and that we're giving a space so they don't feel judged, right? Other ones like social justice, right? Making sure to advocate for individuals who can't advocate for themselves, right? Also integrity, making sure to keep an to be provide integrity within the situation, having competence, right? Making sure our interpersonal skills, making sure that we're constantly learning about new information and incorporating it into our sessions. And so, in my opinion, I think empathy, what we talked about was empathy means hope, providing them hope that we will find the answers, that they're not alone, that we're there to help them and guide them on where they need to be. Empathy is helping them understand how they feel, and also empathy means being supportive, you know, being understanding of the situation and the circumstances they're in, and helping them find an answer so they could overcome. And this means with family as well, being empathetic with most members within the family. And so being empathetic for me means being supportive, being there for them, be understanding, as well as just being that sounding board for them as well. And of course, the more you talk with them and the more you ask them, you learn more about the experience and how to tailor being empathetic for them, empathetic to them. But like I said, it just comes with the characteristics of the individual, the client, all their in social environments, and also just looking at their biophysical parts, all their environments, biologically, socially, mentally, right, psychologically. And so we all have to count all these things when we meet with an individual. But this is why definition of empathy and why we use interpersonal skills when we meet with people and clients. Thank you.